Hi, I'm Dave Flint. I'm the ED doc at Samaritan Medical Center in Watertown, New York. I've called Northern New York my home since 2007. I'm social distancing in my backyard, and I want to talk with you a little bit about the coronavirus pandemic as it applies to Northern New York. New York State for most people means New York City. The big media coverage is focused on New York City right now. How many people have coronavirus in New York City? How many ventilators are needed in New York City? How many people are watching giant boats land in New York City? And there is a tragedy going on in New York City right now. But when we think of New York State from the North Country, we think of something a little bit different. We think of dairy farms, fewer traffic lights, Lake Ontario, the St. Lawrence River, the Adirondacks, real winters, winter storm warnings in April. I'm not much of a traveler. Let's not talk about people 1,000 miles off, but come as near as home as we can. We only have dozens of cases of coronavirus in the North Country. The whole issue may seem a little bit distant. That will change very soon as we are deep into community spread, and the fastest rate of virus spread in New York State is in St. Lawrence County. Most people don't know anyone locally who has the disease, but I do. Last week, a buddy called me at home. He had a fever, was short of breath, and was feeling weak. Based on his complaints and other health issues, I suggested he go to the emergency department for evaluation. Luckily, he was well enough that he did not need to be admitted. 3 days later, when his result returned, I had to let him know that he had tested positive for coronavirus. I dreaded that conversation. The rest of his family has since tested positive. I know that I have had 3 exposures to coronavirus. I suspect that I have more. When I see patients, I wear at least a mask, goggles, and gloves. If I'm seeing someone with respiratory illness, I wear a full face shield and a gown as well. I wash my hands more than normal. I try not to fiddle with my mask or touch my eyes. I clean my desk, computer, and phone. I've been sleeping in the camper for the last 3 weeks to keep from spreading the disease to my family. At the hospital, we're taking aggressive measures to prevent the spread of the virus. When you come to the ED, everyone has masks, people are wearing gloves, staff are wearing gowns when appropriate. We still have plenty of personal protective equipment. The hospital is sparkling clean. Housekeeping staff are the unsung heroes of this epidemic. Visitors are still not allowed in the hospital to protect themselves and others. All staff are screened for symptoms before they come to work. Members of the community are avoiding the emergency department by using urgent care and primary care clinics. This is a fantastic idea because at any given time, we probably have patients with coronavirus in the emergency department. One of my concerns, though, is that out of fear, people will avoid the hospital even when they really need it. Not everyone needs to come to the hospital, but if you're having a medical emergency, definitely come to the hospital. People are still having strokes, people are still having heart attacks and breaking bones. If you're worried that you're having symptoms of the coronavirus and want to talk with someone, call one of the local hotlines. Many people have asked me what they can do to help. You've heard it 1,000 times, stay at home. Today, people that will be hospitalized next week are already sick today and contagious. They don't even know it. If you're contagious and don't know it, staying at home can save someone's life. If you aren't sick, staying at home can save your life or the life of a loved one. We are very lucky in Northern New York. We have had time to prepare. We have plenty of space to provide social distancing. We have personal protective equipment. We have ventilators. The hospital's nurse, staff, and doctors are as ready as they can be to help. Do what you can to help your community. Wash your hands. Don't touch your face. Wear a mask when you're out in public. Unless you're an essential worker or need to get food or medicine, just stay at home.